We're going to switch gears now to COVID news, and Kenya's health experts say that the country's projected fourth wave appears to be stuttering, with reducing caseloads in the Lake Victoria and western regions. However, the test positivity rate staying consistently above 5% remains a concern. Dorcas Wangira examines the COVID-19 trends in the last 7 days, even as Kenyans return to normalcy, disregarding the containment measures in a week of heightened political activity.
At the Ruaraka SDA Church, where Amani National Congress leader Musalia Mudavadi and Nairobi Senator Johnson Sakaja were hosted Saturday, most of the congregants in the church wore masks, but there was hardly any social distancing of at least 1.5 meters apart observed. Likewise, campaigns have intensified ahead of the Kiambaa by-elections, this providing the perfect arena for crowds to mill. In most instances, very little or hardly any masks are worn, even though COVID-19 still remains an ever-present reality. The same occurs in crime scenes. For instance, here in Bungoma, in the Lake and Western region, which had been zoned out owing to a surge in cases, Kemri had projected that there would be a peak of a fourth wave of COVID-19 in the country mid-July, with its start imminent in Nairobi and the coastal region, further projecting 580 deaths and 4,300 hospitalizations. In the past 7 days, however, there has been a reduction in the rolling average of the daily new cases nationally. 2,962 cases have been recorded, with the highest number being 566 on the 8th and the least 185 on the 5th. 47 deaths have been recorded, 11 being the highest on the 8th of July. 1,092 people are admitted in different hospitals. The test positivity rate, however, remains a concern. It was highest on 8th July at 10.6% and consistently above 5%, as recommended before restrictions can be eased for at least 14 days. Kemri had called for heightened surveillance in the Nairobi and the coastal region. The caseload has been highest in Nairobi in all the past 7 days. Uasin Gishu has also recorded the third highest caseload for 4 days. Health experts recommend that what should be watched out for is a spike in individual counties to paint a true picture of the pandemic. However, there is a reducing caseload in the Lake Victoria and Western hotspot, where enforcement of the mitigation measures was heightened. So far, 1,539,087 vaccines have so far been administered across the country, 512,127 being the second dose. Only 2% of adults have been fully vaccinated. Kenya expects a consignment of more than 1 million doses of the Pfizer vaccine and up to 500,000 doses of the Johnson & Johnson vaccine. According to Dr. Ahmed Kelebi, and I quote, "It would be most prudent for powers that be at various levels of national and county governments, together with the citizenry, particularly those in positions of authority within the society, to be more vigilant right now in mitigating the fourth wave instead of waiting for it to peak. The time to remain extra vigilant in mitigating any surges and averting new hotspots is now." End of quote. Dorcas Wangira, Citizen TV, Nairobi.